Isn't it incredible? All these cuts they're proposing in health care are done with a purpose in mind, and that is to reduce the taxes on billionaires. And doesn't it bother my colleague that these people who he's been documenting, who so desperately need health care, are going to lose that if our Republican colleagues have their way, simply to cut taxes for the very wealthy? It's my question.
Leader Schumer, I mean, that's the pain in these stories. The families that I read, the fear that they have, that they're relying on these lifelines that are going to be cut, services that are going to be cut, that are going to affect their beloved parents or their children with disabilities. When they ask the question, why? Is it for a noble purpose? Is it for collective sacrifice? No, the answer that they have to stare at is that you're going to cut services for my vulnerable child or my parents in order to give tax cuts to the wealthiest Americans, in order to give tax cuts to billionaires. Chuck, people will lose health care benefits, and watch the deficit of this nation not increase, explode, which means the cost of our debt payments alone are going to be more than the very programs that they're going to be slashing for families. That is outrageous, cruel, unacceptable, and we have to do everything we can as a people to stop it.
For another question.
Yes, sir.
Despite this fiscal hocus pocus, this fakery, this trickery, which my colleague has alluded to, when they cut Medicaid, when they cut Social Security, when they cut Medicare, those cuts remain just as devastating, no matter what kind. Is that accurate?
I was reading stories, and many of them will live with me. There's a family that's taking care of their two parents in their 90s and their disabled adult children, desperately relying on these programs. No matter what you do or say or call it or label you slap on it, those are the kind of Americans who are stepping up to take care of their loved ones who will get hurt.
Isn't it true that many families just don't have room to take an elderly person, particularly one who needs care, into their homes, and that this would cause chaos to all sorts of people who are not on Medicaid themselves, but have loved ones who need it in assisted living, in nursing homes, in care facilities?
Yes, Senator Schumer, to tell a family to just double up or triple up drives up their costs. It would often, that elder that's living with them that might have dementia demands care. So that family member that's caring for them has to decide, oh my God, am I going to give up my job, which I need to pay the rent, or going to stay home and take care of them, or go to the job and let really difficult things happen? And this is the thing that the leader is pointing out that I think is really important.